How could a speech and language therapist help someone who's struggling to communicate? So first we look at the reason for that difficulty. Some people may have difficulties of hearing or with information going to or from the language centre of the brain. Whilst for others, it might be a problem with moving or coordinating the parts used for speech. For example, breathing or moving the muscles in the throat and mouth. These difficulties may have been present since birth due to a developmental delay, or maybe due to damage to the throat, mouth, or brain. Once we've done a thorough assessment and understand what the difficulty is, we work with the individual and come up with a plan of how they can be helped. We might try to improve the underlying difficulty through rehabilitation, such as practicing different activities or exercises, or we might suggest alternative ways to help the person to communicate. We may suggest writing or use of pictures to help get a message across, either on paper or a tablet. Or if an individual struggles to use their hands, we might recommend using their eyes to communicate, for example, an e-tran frame to spell out messages to a partner. Or we might suggest a powered device where the individual can spell out messages independently. If someone has had their voice box removed, we might help them learn to speak again using voice prosthesis. We might also teach others what they can do to help individuals communicate. To find out more about speech and language therapy, please click on the information bar.